Anatomy of oral cavity and pharynx. Uh, the oral cavity. The oral cavity begins from lips to the junction of hard palate and soft palate. Uh, so it is basically divided into vestibule and the oral cavity proper. The vestibule is lined by the mucous membrane except for the teeth. It is bounded externally by the lips, cheek, and internally by the gums and teeth. Lips, they are lined externally by skin and internally by the mucous membrane, that is also called as the labial mucosa. It is composed of skin, superficial fascia, orbicularis oris muscle, submucosa, and the mucous membrane. The cheek is externally lined by the skin. Internally, it is the mucous membrane, which is called as the buccal mucosa, and there is an opening of the parotid duct opposite to the upper second molar. The oral cavity proper, anterolaterally, it is the teeth and gums. The roof is formed by the hard and soft palate. The floor is formed anteriorly the sublingual region and posteriorly the tongue. Gums, it comprises of gums and teeth. The gums, also called as the gingiva, uh, the soft tissue enveloping the areolar process of jaw, which is composed of fibrous tissue covered with stratified squamous epithelium. Teeth, uh, they form the part of masticatory apparatus. Uh, the primary dentition comprises of 20 deciduous ordinal teeth, and the secondary dentition comprises of 32 permanent tooth. So the permanent dentation of the upper jaw and the lower jaw comprises of the incisors, the canines, the premolars, and the molar tooth. Then the palate, which is divided into two, hard palate and the soft palate. Uh, the palate actually forms the roof of the mouth. The anterior two-third part of the roof of the oral cavity that is formed by the hard palate, and it forms the partition that is the roof of the oral cavity. It forms the partition between the oral cavity and the nasal cavity. The upper nasal surface is lined by the ciliated columnar, that is the uh, respiratory epithelium, while the lower oral masticatory surface is lined by the keratinized epithelium. The anterior two-third part of the hard palate is formed by the palatine process of maxilla, and the posterior one-third part is formed by the horizontal plates of the palatine bone. So, um, this is the area of hard palate, and it has got incisive papilla marked as A, the rugosities which are called as the palatine rugae, and the palatine raphe in between in the midline. The soft palate, it is basically the posterior one-third part of the palate, which is the soft palate. and it is a fibromuscular or a movable muscular fold which separates the nasopharynx and the oropharynx. Um, it has got two borders, the superior attached to the posterior border of hard palate, and inferior border which is free, and it hangs in the midline in the form of uvula. From uvula, they extends two folds laterally, which are the anterior and posterior pillars. The anterior is formed by the palatoglossal. It is the also called as the palatoglossal arch or the anterior pillar, and the posterior is the palatopharyngeal arch or the posterior pillar. So the picture is showing the the area of soft palate, which in the midline forms the uvula. The palatoglossal fold, which is formed by the palatoglossus muscle, and palatopharyngeus muscle forms the posterior pillar, and in between these two is the tonsillar fossa, which encloses the uh, palatine tonsils. The soft palate, it is formed from a dense, it forms a dense uh, fibrous framework that is called as the palatine aponeurosis, and it is formed by the expanded tendon of the tensor velli palatini muscle, and to this aponeurosis is the attachment of the other palatine muscles. So the muscles of soft palate are tensor palati, levator palati, musculus uvuli, palatoglossus, and palatopharyngeus. The origin of tensor palati is from the lateral side of the auditory tube and adjoining part of the base of the skull. It gets inserted over the posterior border of hard palate. The action of tensor palati is to tighten the soft palate and opens the auditory tube. The levator palati originates from the inferior part of the auditory tube and petrous temporal bone and gets inserted over the upper surface of the palatine aponeurosis. The action is to elevate the soft palate, closing of the pharyngeal isthmus, and opening of the auditory tube. The musculus uvuli originates from the posterior nasal spine and part from the palatine aponeurosis, and it gets inserted over the mucous membrane of the uvula, and the action is to pull up the uvula. Then palatoglossus muscle, which takes origin from the palatine aponeurosis and forms the palatoglossal arch, and the action is to close the oropharyngeal isthmus. Palatopharyngeus muscle originates from the posterior border of hard palate and palatine aponeurosis, gets inserted over the posterior border of thyroid lamina and wall of the pharynx. The action is to shorten the pharynx during swallowing. Uh, the blood supply of the palate is from the branches of the ascending palatine branch of the facial artery, then lesser palatine from the maxillary artery, and palatine branch from the ascending pharyngeal artery. The floor of the mouth, it is a horseshoe shaped or a crescent shaped region under the tongue. It has got the openings of the bilateral submandibular salivary glands, which open into the mouth at the sublingual papillae. On either side of the sublingual papillae, there are sublingual folds beneath which lies the submandibular ducts and the sublingual salivary gland. The muscle that forms the floor of the mouth is the mylohyoid muscle. So this is the frenulum linguae, uh, which is a midline raphe fibrous band. On either side of it, there is the openings of the submandibular salivary duct, and on either side, there is the presence of deep lingual vein. Muscles of the oral cavity. First is the muscle of the cheek that is called as the buccinator muscle. Uh, it originates from the oblique line on the outer surface of the body of mandible, and it gets inserted towards the angle of mouth. It decussate from the below, crossing to upper part of the mouth. Those from above crossing to the lower part continue to enter their corresponding lips. The action is they help the tongue to direct the food in between the teeth. The nerve supply is from the buccal branch of facial nerve, and arterial supply is from the facial and the maxillary arteries, the buccal branch. So this is the buccal nerve, that is the branch of facial nerve, and this is the buccinator muscle, which is going to insert over the mandible. It originates from the outer surface of body of the mandible. Then mylohyoid, it is the main muscle forming the floor of the mouth. It is flat triangular sheath, is in the form of flat triangular sheath, which takes origin from the mylohyoid line that is present on the inner surface of body of mandible, gets inserted over the anterior surface of body of hyoid near its lower border. The action is to elevate the floor of the mouth during swallowing and elevates the hyoid bone. The nerve supply is by the mylohyoid branch of inferior alveolar nerve, and arterial supply is from three sources, that is lingual artery, maxillary artery, and facial artery. Then geniohyoid, it originates from the inferior genial tubercle on the back of symphysis menti, gets inserted over the anterior surface of body of hyoid bone above the mylohyoid. The action is to it elevates the hyoid and draws it forwards. When the hyoid bone is fixed, it depresses the mandible. The nerve supply is from the first cervical spinal nerve through hypoglossal nerve, and the arterial supply is from the lingual artery. This is the sagittal section showing the this is the tongue. This is the orbicularis oris muscle. This is the part of the lower lip with inferior part of the orbicularis oris. This is the part of body of mandible. This is the genioglossus muscle. This is the geniohyoid muscle. This is the mylohyoid muscle. Here is the hyoid bone, epiglottis. Tongue. It is a highly muscular organ of deglutition, taste, and speech. It is situated in the floor of the mouth, and in the anterior wall of pharynx. The main function is mastication, speech, deglutition, taste. It has got dorsal and ventral surfaces, root, and the apex that is called as the tip. Uh, the dorsum is subdivided by a V-shaped groove that is also called as the sulcus terminalis. This is the sulcus terminalis. This divides it into the anterior 2/3 part and the posterior 1/3 part, also called as the base of tongue. And foramen cecum, this is the foramen cecum, which lies at the apex of the sulcus terminalis, whereas the circumvallate papillae are found anterior to it. This is the circumvallate papillae, which are lying anterior to the apex of the sulcus terminalis, which is formed by the foramen cecum. Um, the dorsal surface of the tongue has got four types of papillae, that is foliate, filiform, which is most numerous, fungiform, and circumvallate. The anterior portion of the tongue, it is developed from the first pharyngeal arch, and the taste sensations from anterior 2/3 part is carried by the chorda tympani, and it has got supply from the lingual nerve. Then the posterior 1/3 part, which is also called as the pharyngeal part, it is derived from the second and third pharyngeal arches and is supplied by the ninth and the 10th cranial nerve, that is glossopharyngeal and vagus. So overall, the tongue structure of the tongue, that is, it comprises of the uh, mucous membrane, mucous glands, the lymphoid tissue, fat, muscle fibers, and the fibrous tissue. The mucous membrane of the tongue is covered with stratified squamous epithelium. Then the ventral surface of the tongue. Uh, this is the ventral surface of tongue, which actually is a part of floor of the forms the roof of the floor of the mouth. The structures which are present at the ventral aspect of the tongue, that is the frenulum linguae, the fibrous band in the midline, then on either side of which there were the openings of submandibular ducts, then the deep lingual vein. Muscles of the tongue, they are divided into two groups, extrinsic and intrinsic. So extrinsic muscles, that is, they attach the tongue to the surrounding structures. First is genioglossus, which originates from the genial tubercle of mandible, uh, gets inserted over the dorsal surface of tongue, and the action is that it causes protrusion of the tongue. Then hyoglossus, it originates from the body and greater corner of hyoid, gets inserted over the lateral aspect of the tongue, and the action is to cause depression of the tongue. Third is styloglossus, which originates from the styloid process of temporal bone, gets inserted over the lateral side of tongue, and action is to draw the tongue upwards and backwards. Then palatoglossus, which originates from the palatine aponeurosis, gets inserted at the side of the tongue, and action is causes narrowing of the oropharyngeal isthmus. The intrinsic muscles of tongue comprises of four groups: superior, inferior longitudinal, transverse and vertical muscles. The vertical group causes flattening and broadening of the tongue. The longitudinal group causes shortening of the tongue. The transverse group of muscles causes narrowing and elongation of the tongue. The intrinsic muscles are supplied by the hypoglossal nerve, and the arterial supply is from the lingual artery. The innervation of the tongue. The anterior two-third part of the tongue is supplied by the branch of trigeminal nerve, that is lingual nerve. The taste sensations carried through the chorda tympani, that is the branch of facial nerve. The posterior one-third part or base of the tongue is supplied by the ninth and 10th cranial nerve, glossopharyngeal and vagus. And the posteriormost part of the tongue is supplied by the vagus nerve. So the lining mucosa of the oral cavity is the non-keratinizing squamous epithelium. It covers the inner surface of lips, cheek, floor of the mouth, soft palate, and ventral tongue, except for the gums. And then pharynx. Pharynx is basically a fibromuscular tube which forms the upper part of the air and food passage. It is regarded to be 12 to 14 centimeters in length. It extends from base of skull, that is basio-occiput and basisphenoid, to the lower border of cricoid cartilage, where it becomes continuous to form esophagus. The shape is basically conical. The width of pharynx is 3.5 centimeter at the base, 1.5 centimeters at the pharyngoesophageal junction, which is regarded as the narrowest part of the digestive tract apart from the appendix. So these are the divisions of pharynx. It is divided into three parts: nasopharynx, oropharynx, laryngopharynx. The boundaries of pharynx: superiorly, it is the base of skull; inferiorly, it is the lower border of cricoid cartilage at the level of C6. Anteriorly, it is incomplete, where it communicates with the nasal cavity, oral cavity, and larynx. Posteriorly, it is continuous with the prevertebral fascia, separating it from the cervical spine. The routes of communication is basically through the posterior nasal aperture or choana. It communicates with the nasal cavity. Through the oropharyngeal isthmus, it communicates with the oral cavity. Then through the eustachian tube, it communicates to the medulla. Through the glottis to the larynx and tracheobronchial tree, and through the upper esophageal sphincter, that is cricopharynx, to the esophagus. The structure of the pharyngeal wall from within outwards, it consists of four layers: the mucous membrane, which is continuous with the mucous membrane of the eustachian tube, nasal cavity, oral cavity, larynx, and esophagus, and it is lined by the stratified squamous epithelium. Second is the pharyngeal aponeurosis formed by the pharyngobasilar fascia. Third is the muscular coat, and fourth is the buccopharyngeal fascia. Now, nasopharynx. Posterior-superiorly formed by the body of sphenoid and basilar part of the occipital bone, basisphenoid. The posterior wall is formed by the pharyngobasilar fascia. Inferior wall is formed by the soft palate. and lateral wall presents nasopharyngeal tonsils, that is the adenoids, lower end of eustachian tube, and the fossa of Rosenmuller. So this is that area which is located behind the nasal cavity and above the lower border of soft palate and the passavant ridge. And this is what respiratory function. Then um, oropharynx, the middle part of pharynx that lies behind the area of oral cavity. It extends from the soft palate to the upper border of epiglottis. The boundaries posterior wall is related to the retropharyngeal space. Anterior wall is deficient above. Below it presents the base of tongue, lingual tonsils, vallecula. The lateral wall presents the palatine tonsils, anterior and posterior pillars. The laryngopharynx from upper border of epiglottis to the lower border of cricoid cartilage. Anterior wall is formed by the inlet of larynx, posterior surface of cricoid and arytenoid. Posterior wall is formed by the constrictor muscles. The lateral wall is formed by the piriform fossa, aryepiglottic fold, thyroid cartilage, thyroid membrane, and internal laryngeal nerve. The muscles of the pharynx, superior, middle, and inferior constrictor muscles. The superior constrictor originates from the pterygoid hamulus, pterygomandibular raphe, posterior end of mylohyoid line, and posterior part of tongue. The middle constrictor originates from the stylohyoid ligament, lesser cornu of hyoid, upper border of greater cornu. The inferior constrictor has got two parts, thyropharyngeus, which originates from the thyroid cartilage, and cricopharyngeus originates from the cricoid cartilage. Both of them get inserted into a median raphe at the posterior wall of pharynx. Then three longitudinal muscles, stylopharyngeus, palatopharyngeus, and salpingopharyngeus. All the muscles of the pharynx are supplied by the cranial accessory nerve through branches of vagus, except for the stylopharyngeus, which is supplied by the glossopharyngeal nerve. The blood supply is through the ascending pharyngeal branch of external carotid, branches of facial artery, lingual artery, branches of maxillary artery. The lymphatics drain into the retropharyngeal and deep cervical group of lymph nodes. The functions of pharynx: it acts as a conduit of passage of air and food, helps in deglutition. The oropharynx forms the part of vocal tract for certain speech sounds, helps in appreciation of taste, provides local defense and immunity against harmful intruders into air and food passages. There is a presence of Waldear's ring, that is the lymphoid tissue present in the oropharynx and nasopharynx. It comprises of two rings, the inner ring that comprises of palatine tonsils, dual tonsils, the nasopharyngeal tonsils or the adenoids, the lingual tonsils, the lateral pharyngeal bands, and the outer ring that comprises of the different group of lymph nodes. The functions of Waldear's ring is basically formation of lymphocytes, then antibody formation, especially in the elderly years of age, early years of life, protection of the lower respiratory tract, and formation of plasma cells.